Welcome to our NPTE Question of the Day series, presented by Typical PT. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. The question is, a 68-year-old patient is brought to the emergency department with marked confusion, labored respiration, and cardiac dysrhythmias. Arterial blood gas, ABG, analysis reveals a PaO2 of 35 millimeters of mercury. Which of the following conditions is the most likely explanation for the patient's presentation? A. Mild hypoxemia. B. Moderate hypoxemia. C. Severe hypoxemia. D. Respiratory failure. Go ahead and pause the video right now, do your calculations, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice C, severe hypoxemia. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Answer choice C, severe hypoxemia, is correct. The patient's presentation of marked confusion, labored respiration, and cardiac dysrhythmias are all critical symptoms associated with extremely low blood oxygen levels. Looking at the PaO2 value classification table, a PaO2 of 35 millimeters of mercury falls into the less than 40 millimeters of mercury range, which corresponds to the classification of severe hypoxemia. The clinical significance for this range is a critical decrease in oxygenation, urgent intervention needed. Now, let's look at why the other options are incorrect. Answer choice A is incorrect because mild hypoxemia corresponds to a PaO2 of 60 to 80 millimeters of mercury and typically presents with moderate tachycardia or early signs of respiratory distress, not the severe symptoms observed here. Answer choice B is incorrect because moderate hypoxemia corresponds to a PaO2 of 40 to 60 millimeters of mercury. While this level may cause malaise, lightheadedness, or nausea, it does not typically result in the marked confusion or cardiac dysrhythmias seen in this patient. Answer choice D is incorrect because respiratory failure is a broader term that implies a failure of the respiratory system to maintain gas exchange, and may involve both hypoxemia and hypercapnia. The specific PaO2 value of 35 millimeters of mercury aligns directly with the classification of severe hypoxemia. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.